And we're back. Welcome to episode 2 of Off-Road First Aid. This is a series where we're going to be going over teaching you guys some first aid from a qualified paramedic to teach you guys how to properly respond and I suppose notice those first aid scenarios that happen when you're out camping, you're out hiking, whatever you're doing off-grid, and sort of giving you a few more tips and tricks of what I've learned and what I've applied in my field of study. Last you would have seen of me is in the previous episode, which I'll put the thumbnail up there somewhere. You would have seen that we went through a whole bunch of foundational knowledge, anywhere from your Dr. ABCDEs, we went through consent, and that was great. That was really good to sort of build a foundational knowledge of what you should know going into first aid scenarios that will put you miles ahead of someone who just knows nothing, and now you are better prepared for it. This episode today, we are going to be diving deeper into something a little bit more of a specialty, and that is airway and breathing. These are obviously very crucial to living, and there are a number of small things which you may encounter when you're out and about on your adventures, and having this backup knowledge of these different scenarios, what's going on in the body and how you can best treat it and manage it out in the bush until you get to medical personnel is going to put you miles ahead of someone who doesn't know anything. So sit back, grab a cuppa or a coldie, and we're going to go through airway and breathing for off-road first aid. I am currently filming at home. I'm a bit grounded at the moment. There'll be a video in the future going out to what's going on with that, so keep an eye out for what's going on with the 200. I've chosen to enjoy a coldie for this one. So your airway, first thing we're going to talk about, it is super important and obviously is completely vital for continuing to live. Airway obviously involves anything from your mouth through to your airway and then down into your lungs, basically getting air in and out of the body, allowing for that oxygen to get to your lungs and then get transferred into your bloodstream. What we are talking about mainly with your airway is keeping it patent and keeping it open, allowing for that air to move in and out of your lungs as easy as possible and for nothing to obstruct it. Now those obstructions can come in a few different forms. The first one and most obvious that we all think of is something like food. You try to swallow something, it gets stuck, you start choking on it. Could also be things like mucus or secretions. So if you're very unwell, you've got some other medical condition happening, sometimes the mucus can get so thick in your airway that it hinders your ability to breathe. And the other one is inflammation as well. So when you have any sort of a medical scenario or some sort of medical complication where your airway starts to experience inflammation or swelling, that can also lead to either restricted or completely blocked off airflow. For the average human body, losing airflow to the brain for 4 minutes or more will result in permanent brain damage. From there, it becomes more severe depending on how long until oxygen is restored. More than 10 minutes without oxygen is a very bad sign for ongoing life for the patient, because of just how much of the brain has started to suffer and die due to lack of oxygen. So obviously you can see how important it is to get that airway open and get that person breathing under their own steam. So when we're talking about open airway, we're talking about a patent airway. So if you're watching this, if you're able to breathe, you've got a patent airway, which is when it's open and clear. A non-patent airway is usually obstructed or restricted. So what we're trying to do is make sure that our patient has an open and unobstructed airway. So the first scenario we're going to talk about, especially if you're in an off-road situation, you're out camping, everyone's having fun, eating, got your cheesels and chips and bits and pieces you're eating, and someone starts to choke. Their airway is obstructed, it is no longer patent. The food's lodged somewhere in their airway, it's gone down there instead of your esophagus, and the person is starting to choke. How are we best going to help that person out? Obviously you can't just call 000. Like I've said, you've got that 4-minute time frame where you've really got to restore airflow to the brain. So you've got to act fast and know what best to do. You're watching this video and you will be best informed and best educated of how best to proceed. Now I'm sure everyone knows of something called the Heimlich maneuver, which is basically where you grab someone from behind in a big bear hug, squeeze them really tightly and try to sort of jiggle the thing out of their throat. That used to be known as the best thing to do. It is no longer best medical practice to perform for people due to people doing some research into it and finding that it ended up causing more harm than good. It wasn't very effective. And there are better ways of going about helping someone who is choking or got an airway obstruction. So the two you were going to do are called back blows and chest thrusts. So the back blow is essentially you get the person, you want them to stand up, lean slightly forward, and you're going to use the palm of your hand and deliver a nice solid blow between the shoulder blades. What that's going to do is just put that pressure on the lungs, hopefully get them to contract nice and quickly and eject anything that's in there. So the best practice with these is you're going to do 1, you're going to check the airway, you're going to do 2, you're going to check the airway, you're going to do 3, and go on until you go up to 5. Obviously checking the airway to make sure that whatever's lodged in there has come out. If it hasn't dislodged, you're going to move over to chest thrusts. So that's basically where you're doing it in the opposite direction. So you're going to use the palm of your hand and you're going to deliver some nice solid blows. Again, 1, checking airway, 2, checking airway, up to 5. You're going to keep doing this process and looking for that airway to become open and patent, and for whatever's lodged in there to shoot out and hopefully not get stuck in your hair. That is the best way to go about it, and you're basically going to alternate between those two. You're going to do back blows, chest thrusts, back blows, chest thrusts, constantly checking the airway to see if it's become patent, and hopefully this sorts the issue out for the patient. Now, if this person continues to choke, if for whatever reason your back blows and chest thrusts are not sufficient, this person will eventually pass out from lack of oxygen. This is where they're going to become unconscious. They're not going to be able to breathe on their own, and you are going to need to help them out from there. So if this person passes out, the first thing you're going to do is get the person to lay down, or you're going to lay them down. They're going to go into the recovery position. We talked about this on the last episode as well. Laying on their side, one knee slightly elevated. You're going to lay the arm out and have the head tilted downwards. What that's going to do is if there's anything in the mouth or the airway, it can drain out much easier. You're also going to lift the head and you're going to pull down on the jaw to really open that airway up so that you can see what's in there. And if something's in there, it's allowing it the best passage to escape, essentially. So allowing that there, anything can drain out or fall out if it needs to. Look in the person's mouth. If you can see things in there, 2 fingers, you're going to scoop into the mouth. You're going to grab out whatever you can, only going as far as you can see. If you cannot see where your fingers are going, there is a chance you may push something further down that person's throat and cause a bigger issue than you're already in. So only scoop as far as you can see. Scoop, 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 and hopefully with any luck you are going to get that obstruction out of this person's way. If you are not successful with making this patient's airway patent and open, you are going to need to do the best you can to get that patient to a medical professional, calling 000, getting them to a hospital, whatever it may be in whatever area you're in, and helping them out as best you can that way, because you've done all that you can to get this thing, get whatever it is out of that person's throat. You'll be dealing with critical care paramedics and ER doctors in hospitals who will have many more techniques and different things they can do to open up this person's airway, things which are beyond the scope of a bystander such as yourself, or even just a base paramedic. You're going to be talking to like critical care paramedics, that sort of stuff. They've got skills, they've got knowledge of how to do that, and you need to get this patient to them to obviously get them the help they need. If you do manage to regain patency of this person's airway, you get it to open, you get whatever obstruction is out of there. They've passed out, they may need recovery breaths to help them to start breathing again, and obviously getting oxygen back into their lungs. You expel oxygen out of your breath, so the best way to do that is with what they call emergency breaths, which is your breathing and your CPR. The best practice is to use a face shield or face mask, which you'll get in a first aid kit. If you don't have that, whatever's going to save that person's life, you've got a very small window of opportunity to help them out, and getting oxygen into them as best you can. So the best way to do it is for your face to be perpendicular to theirs, seal your lips around their mouth, and you're going to blow. You're going to go, and you do 2 breaths. What you're going to be doing is looking then down the person's chest and down towards their stomach. If you notice the chest rising and falling as you would expect, that's great. If you were encountering resistance with your breathing, you're trying to push air into their lungs, or if you feel like it's just not going anywhere, there may still be obstructions further down the airway that you cannot see or interact with, and in which case then obviously get them to hospital or to ambulance as quickly as possible. So the second thing we're going to talk about is asthma attacks. By definition, asthma is a medical condition which causes the narrowing, inflammation or irritation of the airway, obviously leading to swelling, leading to restriction or blockage of the airway, and making this person's breathing very difficult. Asthma is usually a pretty chronic condition. Most people will know if they have asthma, they've already been diagnosed with it, and as such they will know when they're having it and what best to do. But as a bystander and as someone who goes out camping with people, who goes for a hike or goes for a swim, goes adventuring in the great outdoors like we all like to do, you should also know a little bit about it as well and how best to treat it. For whatever reason they have a really bad asthma attack, they may not be able to relay to you the instructions of how best to help them. So you need to have a bit of background information. If you are traveling with someone who suffers from asthma or can suffer from asthma attacks, they should have a puffer with them. Usually that is in the form of salbutamol. That's the medication that is usually in it. Different names for it can be Ventolin or Proventil, depending on whatever brand they've decided to go with. And that will be used with a puffer. So they'll put that in their mouth, they'll puff on it, that releases the medication into their mouth and into their airway. They're able to use it. Sometimes this medication may end up getting trapped in the mouth and not traveling further down the airway where it will do the most good. So in that case, you will use what's called a spacer, which is basically like a chamber that sits between the puffer and the mouth, and you will squirt the Ventolin or Proventil into it, and that will expand. It will nebulize with normal room air, and the person will then take 3 or 4 deep breaths to bring all that all the way down into their lungs and for it to do the best effect. If the person is with you and that they have one, then just get them to show someone how to use it, because that way, you know, you're better prepared. Also, if you have kids who have asthma, usually they will need to have a spacer installed because of their smaller airways, and it doesn't travel as far down the airway because of having a smaller airway. They're kids, everything's smaller, so they have to use a spacer. Now, salbutamol can be used every 20 minutes. So that means that you have your puffer, you take 1 puff, leave it for 20 minutes to see if things improve. If not, you can have another puff of that as required. Obviously, you can get to a stage where it'll be too much, but you're out in the bush, you've got, you know, no one else to help you. You do what is necessary. So you may need to keep sort of having those different doses until there is a desired effect. Asthma attacks are usually set off by something which is an allergen. This may be something environmental, and usually if you're out camping it will be. Things like different pollens that are in the air, maybe a different food, it may be stress can also indicate it as well. And sometimes really cold environments can trigger it as well. Any sort of that irritation, inflammation in the airway can escalate into an asthma attack. So obviously if someone's having an asthma attack, get on the Ventolin as quickly as you can. They need to sit down, they need to start taking some deep breaths and get them to relax. Reduce the blood pressure, just bring everything nice and calm, and that will also help with the inflammation as well. Also try to remove any triggers away from your patient, or bring your patient away from whatever triggers that may be. Bring them into a tent, into a swag, into the car, whatever it may be, just to isolate them away from those environmental triggers. And the final thing you're going to do is get them to sit there and drink a warm drink. Cup of tea, coffee, hot chocolate, whatever it may be. Basically the hot drink going down your esophagus, not your throat, just gives that little bit of heat and helps to alleviate some of the symptoms from all that swelling and stuff that's going on in there, which can really help. Now, lastly, we are going to talk about anaphylaxis, or a severe allergic reaction. This is not a very nice one. If you come across it, usually you need some sort of medical personnel to step in. But if people are susceptible to severe allergic reactions, they can also know how best to treat them. And that's the information I'm going to pass on to you. So anaphylaxis, or a severe allergic reaction, is essentially an allergic reaction which affects 2 or more of the body systems. So usually when you'd have a reaction to something, you get a bee sting, you know, there's a reaction there, get a bit of swelling. You know, you may have a reaction to like a food allergy, where you might start sort of feeling nauseous, that sort of thing. It's when you start to have multiple different body systems affected by this allergy that it can become life-threatening very quickly. So obviously the big one is when the airway starts to constrict due to allergy. This will happen very rapidly. Any sort of severe allergic reaction, so that again, that may be bee stings, it may be like shellfish or peanuts, maybe some sort of insect bite or whatever it may be. These can cause an anaphylactic reaction, which will cause swelling around the airway. It can either completely restrict it or just block it, and is obviously very life-threatening, because there's not a huge amount that you can do as a bystander to alleviate that swelling in there. Most people who are susceptible to these severe allergic reactions carry an EpiPen with them. So EpiPens are a small little pen device which inside carries epinephrine or adrenaline, and this is basically used to counteract the swelling which can occur as a result of the allergic reaction. Just like your Ventolin, if you've got someone in convoy who is carrying an EpiPen, please get them to show everyone where it is and how to use it, just so that for whatever reason they do have an anaphylactic reaction, then everyone else can react to that, rather than this person being the only person that knows. And your airway starts to clog up, you can't tell anyone what to do, so they've got to know it, and that's why I'm teaching you guys now. So with your EpiPen, the different manufacturers of them will have different instructions. They're usually pretty simple. you need to apply it so it's an intramuscular injection, and it needs to go into the external part of your outer thigh. So usually sort of where your pocket would be on the outer side of that, it needs to go into there, perpendicular to the skin. Apply the EpiPen, press a button, whatever it's got on there, and it will inject that epinephrine into the bloodstream. It usually is a pretty quick reaction if the epinephrine is going to help, between 10 and 20 seconds for it to really kick in and do its work. And you will start to notice an improvement in that patient. If there is still no improvement in this patient, after 5 minutes you can administer another EpiPen. Ideally go in the opposite leg, just so that you're not sort of drilling the same holes as before, but it also helps with circulation, just getting that epinephrine into a different part of the bloodstream, and helps it to flow through the body much quicker. If you do not have an EpiPen with you and you believe someone is having an anaphylactic reaction, there are other things you can do. Not quite as good as epinephrine, obviously. That's the best thing for it. But you're out bush, you're in dire straits. Someone's airway is choking up, and you need to do the best you can. Now this is swelling that's happening on. So obviously, what really helps with swelling? Think about rolling your ankle. What do? Apply some ice to it, something cold. What you want to do is get whatever cold things you have, whether it's ice, whether it's a bag of peas, might be an ice cream, whatever it is out of your fridge, and you're going to put that over their neck to try to reduce that swelling. You don't want to compress the neck. So usually they'll say a cold compress. You don't want to compress. You just want that cold to be on their neck and help to resolve that swelling. You want that patient to lay down. Then you want to sort of work them through, just breathing, relaxing, calming down. You want that blood pressure to start coming back down, and for this person to start relaxing and opening up their airway as well. One thing I will mention is if you allow an anaphylactic shock to continue, so what's going to happen is obviously this person is struggling to breathe. The body itself has a number of different systems it employs to try to maintain homeostasis, to maintain the body working as per normal function. Once it reaches the end of that, it starts going into shock, and in this case it's what's called anaphylactic shock. And what that's doing is the blood pressure in that person will rapidly drop. They will get hypotension, so low blood pressure, and basically their blood pressure falls through the floor. The body is preparing for a fight or flight response, in this case a flight, where it is preparing to maintain the most vital organs in the body, which are all in the torso and in the head. They're not worried about trying to pump blood all the way out to your extremities. They're like, no, we've got to survive, and we're focusing on that little bit. So it'll drop the blood pressure. You can monitor this. Obviously you don't have a blood pressure machine or anything while you're out in the bush. Feel their pulse. You're not too worried about the pulse rate. That's going to be all over the joint in this situation, and try to count that out is just going to be silly. Grab a pulse. Yep, it feels really strong. As this is going on, keep an eye on their pulse. If you feel it getting weaker, like, oh, it's not as strong as it was before, I can barely feel it, or whatever it may be, you have to go further up the arm to find a pulse. That will be an indication that their blood pressure is rapidly dropping. If that's the case, get this person to hospital ASAP. Whatever you can do for that person, call 000 and do the best you can, because they're starting to get in dire straits. So I really hope that this information has helped you out. Obviously, getting out bush, camping, hiking, four-wheel driving, whatever you're going to be doing, enjoying the great outdoors, you're going to come across some of these situations eventually, and having a bit of knowledge will go a huge way in improving the outcomes of your patient. So in the next episode of Off-Road First Aid, we're going to be talking about snake bites. We're going to go through our snake bite kit. We're going to go through what you should do in the event of a snake bite, all the way from getting bitten all the way through to getting to a medical facility to have it properly sorted. So stay tuned when that one comes out, and we'll catch you next time on Off-Road Crusader. Cheers.